So when a patient goes into your office and they are currently wearing a denture, what's discussed and what are the options when it comes to mini implants?
They can come in and they have a couple of choices. They got a denture, they want to get rid of the denture, they want to get rid of that puffy look of the denture. So what I show them is a couple of options. One is a snap-in, snap-out denture. That's a smaller, thinner denture. It actually works with the same implant that I can use for the second option. The second option is actually putting in a few more implants, and I could actually snap in and snap out a slightly bigger form of a denture. It's not quite caps, but it's not quite the denture.
Okay.
Now the third option, well, to me, that's the only option if I was a patient, and that would be putting in a few more implants.
Like what, about 10 or 12?
Nah, you need between 7 and 13, depending on
the little implants, right? They're mini implants.
They're very thin implants, but they have a lot of dynamic control the way they've been designed, so they lock in when you put the crown, the cap, the tooth over it, so they stay. And what we do with that, when I get my 7 to 10, I can actually cement those teeth in, and there's nobody that's taking those teeth out. They stay.
Eat? What do they eat? What can they eat?
Gosh, they can eat anything, anything at all. The materials I like to use is something called zirconia. You've heard of zirconia diamonds? Those are
yeah.
Yes, those fake diamonds are actually stronger than the real diamond, but the zirconia cap we made is actually as strong or stronger than any other.
So it's not plastic?
No, not plastic. No, the permanence is zirconia.
Okay, interesting.
They're really very, very strong.
Chew a steak?
You could chew a steak, you could chew chicken. I would never, you could, but I'd never recommend patients eat into bones, because bones are not what we chew.
Okay.
Because you'll break something, whether it's the bone or you'll break a tooth.
What if the denture wearer has been wearing their denture 30 years? Can they still do this, or they don't have enough bone?
No, they have. I'm doing this for 4 years, and I've worked on some very challenged bone, very, very thin bone. And I have yet to find a patient that didn't have enough bone to do it. I've really worked on quite a few dentures. I've done hundreds of them, and I've yet to find it. I had one where I actually had to take a very, very, very fine tip to make a teeny opening, but I was able to get that implant in very easily, and there was no pain.
What's your oldest patient?
85, 86.